Hello, and welcome to Mental Health Matters Podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here with Dr. Mark Burton, and before we get started, I want to acknowledge our technical support because I feel like we don't do that often enough. So I want to give a shout out to Curtis, to my
Great
husband.
thanks to Curtis. I agree.
Yes, because he is our technical support and he keeps us running because there are times where Mark and I are just a lot baffled.
I think it's mostly me, Liz. I'm
But
pretty
I
sure.
can't fix it
I'm pretty
either.
sure I'm the one who is baffled most of the time.
Yeah, but I don't know how to fix it. I mean, he comes in here and he's like, yeah, Mark, just do this. And he somehow makes it work.
Right, but I'm the one who either breaks it or doesn't know what's going on. So anyway, thank you to Curtis.
Yes, thank you to Curtis, our technical support, technical manager, all things technical.
Yeah.
So this week, we're going to get into addiction recovery. Now, we have done an episode on addiction in the past, and I thought it would be good to talk about the recovery side of addiction. So if you want to go back and get our take on kind of addiction and the root causes and kind of why that happens, you can go back and find that episode. But first, I want to briefly go over what addiction actually is, because it's very common nowadays for people to label something addiction. And there's a couple of different reasons why they do that. But oftentimes, people will label behaviors that are maybe more just compulsive or behaviors that are maybe a little bit problematic. But there's a very specific criteria that has to be met in order for it to fall into addiction.
Right. And at the outset, I want to say this is certainly not my area of expertise. I mean, there are people who specialize in this. And so I certainly know a little bit about it, but it's just something we don't treat addiction at Aspen Grove. In fact, I think it's true, at least in Utah, that for a lot of people, there's a special either state license or state certification that is granted to people who work with addiction. And so I think that, going off of what you just said, I think often if people are either uncomfortable with behavior or don't like the behavior, then often they throw out the word, you're addicted to this. And I think it's more to shame the person. More than anything. But from a psychological standpoint, so addiction for us is either a psychological dependence or a physical dependence or both on the use of, it can be substances, it can be an activity. I think it's even true that you can be addicted in some ways to other people who are, unhealthy. So I think it can be really a myriad of things. I think we often think of it just as like alcohol or drugs. But I think it can certainly be more than that. So I think there are people who are addicted, say, to gaming, but that's not always the case.
Yes.
But you might often, if you think, oh, you're playing the games too much, I might throw out, well, you're addicted to it. And so if it doesn't meet that criteria of being psychologically or physically dependent on it, and which you would know, some of the ways you'd know that is, do you miss work? Do you stay up all night doing it? Do you spend large amounts of money on it? Those are some of the markers that we look at to see if it falls into that category. There are some people who like play games or all night long. They don't go to sleep. So that's really problematic. But I think for a lot of cases that nowadays addiction gets thrown out a lot for porn use, certainly, but that certainly happens. I don't want to say I don't think it happens. Yes. I think it does happen, but I think it gets thrown out to shame people. What do you think? I thought about this. What do you think is something that most people are addicted to? What would be your guess?
Oh, technology, their cell phones or social media.
Social media. Good for you. I didn't.
Oh yeah.
I think you're right. But a lot of people don't think of it that way as an addiction, but I think they are.
Right. One of the other factors is people will continue the behavior despite negative social ramifications or negative social consequences.
Right. Yeah, that's a very good point. That that's one way that you can know. Like, is it destroying your family, or is it destroying relationships, and
Yeah.
you continue to do it? Then
Yeah.
I think it certainly falls into that category of addiction. Right.
Right. I mean, and so, you can drink alcohol and it's not an addiction, but if you're getting drunk at work or you're drinking at work because you can't go without, it's an addiction. Or if you are viewing pornography at work, then that's an addiction.
Right. But I think it can be if you're getting drunk every night at home.
Yes. Yes.
That's an addiction. If you're viewing porn every night and through the early morning hours at home, which I've had clients who do that. That's an addiction.
Yeah.
If you can't pull yourself away to go to bed or to be in relationships with others, then that's an addiction.
Yeah. And so, I mean, social media addiction, I think because everybody does it, it's so socially acceptable that I think people just don't see it as problematic. But if you're sacrificing sleep for social media, and again, I think another important distinction to make too is this has to be repeated behavior. So,
Mhm.
right, there has to be a pattern. So, I mean, because I think a lot of gamers out there can relate to a new game coming out and they'll binge play the game, right? And
Yeah.
they'll sacrifice a couple nights of sleep because they're excited about this game, right? Or, maybe something big is happening on social media and you're following along and you lose track of time. So if that happens sometimes, that doesn't necessarily classify an addiction. It's when it becomes a pattern. So it's
Yeah.
when this is consistently going on, then it can fall into the realm of addiction.
Yeah. So I want to mention someone that I think is a really good source of information. I know I've mentioned her before. Her name is Anna Lembke. She is a psychiatrist at Stanford, and she wrote a book called Dopamine Nation. But I think that if our listeners are interested in a more in-depth exploration of addiction and recovery, that there are two. She participates in two podcasts that I know of, probably more, but these two are really good. The one is with Andrew Huberman, and then also a guy named Rich Roll. And so she's talking about addiction and recovery and dopamine, mostly dopamine, because you can't really talk about addiction without understanding the role of dopamine. Anyway, I think both of those, the book, I've read the book, I think the book is a great book for anyone. Anyway, one of the reasons I thought about her is she appeared in a Netflix documentary called The Social Dilemma. And as she was talking, I think she talks about it in that documentary, but also in these podcasts, she talks about social media as being designed as a drug. It
Yeah.
has all the elements of a drug. And, people need to realize that. But it's really hard to change that behavior because, as you pointed out, in some ways it's socially acceptable. But this isn't going to be surprising, certainly, to listeners to know that I see couples in my office all the time where one of them or both of them problematic phone use.
Yeah.
You're at dinner or you're somewhere, like maybe you're sitting, on the couch together. You're supposed to be connecting, and somebody pulls out their phone
Yep.
and they start scrolling, and they pull out their phone because maybe they got some sort of alert on Facebook or however that happens. That social media, I don't participate in any social media, and not necessarily because I thought it's addictive, but I just think there are overall very negative things about social media for our culture as a whole. And so, I think that, is it true, like on Facebook, you get alerts like somebody just posted and your phone would ding or something? Is that what happens?
Oh, you can. I have that turned off because
Okay.
I
Some
can't.
people would have it turned on.
Yeah, I mean, I think both Curtis and I have that turned. I mean, you can turn off. It's called a push notification. So
Okay.
it's the same if you get a text message
Okay.
from somebody, so you can enable push notifications. And so yeah, Facebook. And that the problem is it will alert you every time every time someone reacts. So if somebody just likes your post. And so I'm on Facebook and that's the only platform I'm on. But I mean, I don't want to do any others. I mean, it's hard enough for me just to keep up with Facebook. I
Yeah.
mean, and that's another problem is there's so many platforms that people have to keep up with. That's time consuming. That's a lot of time out of
Yeah.
your day. And I also want to acknowledge that there are some good things about social media, right? I
Well,
mean,
right. And I acknowledge that as well. It's just that
yeah.
if I mean, I don't know how true this is, but like alcohol or red wine, some people say that having a little red wine every night is good for your heart. I
Right.
think there's some dispute about that. But again, the same thing applies. You can have a little bit, or, do you get hooked and have a lot? And I think the same thing's true with Facebook or social media. So I agree there are positive things about
Yeah.
technology, and
So
there are a lot
here
of negatives.
so here's my thing with red wine. I think you can get the same effects if you take the alcohol out. And
Well, that's true.
social
Well,
media is
that's
the
true,
same.
but I do that. I take a thing called resveratrol, which is the
Yeah.
active ingredient. So,
Ex-
you can get it without doing the red wine. I was just
exactly.
using that as an example
Yeah.
that some people say, yeah, a little bit's good. I had a physician who told me, yeah, a little bit's good, but it's not worth the risk, is what she
Yeah.
said.
Yeah.
So,
Yeah. All right. So, addiction recovery.
okay.
Now, there are various programs out there that are available. And so let's very briefly go through those because, I mean, for the most part, people can look them up. I think the one that most people are going to be familiar with is the 12-step program. I'm pretty sure that one's
Right.
very common.
Right. And so 12 step, but, as I think about recovery, I think there are different ways to go about it. Certainly doing group work. I think that group work is pretty powerful. And
Hmm.
one reason I think group work is powerful is because there's always a component of shame
Yes.
that's in any type of addiction. And I think, like, if you take AA, or any 12 step program, part of it, like it, the stereotypical way you start an AA meeting is, hi, I'm John and I'm an alcoholic.
Yeah.
And so part of that is you put it out there and it decreases the shame because everybody in that room is saying, hi, I'm Mary and I'm an alcoholic.
Hmm.
And so that's the benefit of group work. It's very, very, very powerful. But I think that, so there are different levels. Like if you were talking to someone who, works all the time in addiction recovery, what they're going to do is they're going to, do an assessment and then assign you like a level of care. And so you can do outpatient care, which is just seeing someone, say someone weekly, or
Hmm.
if you need it more intense, more often than weekly. If you go up a level, intensive outpatient programs that what is it called now? It used to be Unibin, but I think they've changed the name up at the University of Utah, and they have
Hmm.
actually there are a lot of pretty good outpatient intensive programs where it's like a day program. So you don't stay there. You go in maybe once or twice a day, sometimes 5 days a week, depending on the level of care you need. There are partial hospitalizations, there are full residential, and we can talk about the reason that's pretty popular. I think there are many different types of residential programs. And I think for listeners, you have to be careful because you want someone who has a pretty good reputation,
Hmm.
because I think that there is a lot of money involved in these
Yes.
residential treatment programs. They cost a lot of money. Sometimes insurance pays, sometimes it doesn't. But, I think there are treatment programs out there that are just in it for the money and that they probably aren't that effective. But there are some that aren't, like in Utah. And I know we have a lot of listeners in Utah. The one at Sundance, it's called the Cirque, and they actually have two different facilities. But I've heard really good things about Le Cirque, and I'm not saying that's the only good one in Utah. I'm just saying it is a good one. So you have all those different levels of care, and
Hmm.
so it depends on what you need. And so if you're struggling with an addiction, then I think that probably one thing, the way to approach it is to have an evaluation, have someone who's really aware of the different levels of care so that you can be guided. I think often you need help, but I don't think you need help all the time. Like if you were to read Anna Lembke's book, Dopamine Nation, or listen to her, I think she would say that many people can handle addiction on their own.
Okay.
And the thing to be aware of, so if we go back to dopamine
Hmm.
and dopamine's role, she would say that what happens is, and I think this is certainly backed up by science, that in any addictive behavior, there's this excess of dopamine that's released.
Mm-hmm.
And so for all of us, we have this, like if we had no addictive behaviors, we'd have what they call a baseline. I think she calls it tonic, but this baseline level of dopamine, the release that we have with us all the time. And so like the most addictive substance, what do you think it is? This is probably an easy one.
Alcohol.
Heroin.
Heroin. Okay.
Heroin. For some reason, heroin has a huge hit, very hard. And I think that if you talk about relapse with heroin users, I think it's 90%. I think
Wow.
very, very hard. Whereas for the others, it's much less than that. And we can talk about relapse later, but heroin is a highly addictive substance. And so what happens is in any addictive behavior, so it can be behaviors, it can be substances, then what happens is your dopamine system is getting dysregulated. And so her belief, like if you're going to try and do this on your own, which some of our listeners may try and do this, then she would say what you want to do is have a total reset of your
Yeah.
dopamine, that reward system. And so a lot of the inpatient programs are 30 days. I mean, I
Mm-hmm.
don't know, you heard 30-day program, but she believes that, and from her research, that there's actual physiological things that go on, that 30 days is about the time where you need to be totally away from the substance.
Mm-hmm. Okay.
So for instance, if it's alcohol, that's why if you go into residential treatment, the good thing is that hopefully you're totally away from the substance. And so you
Yeah.
can reset, that dopamine reward system. I think the problem is like in that 30 days, like if you're trying this on your own, that first week is really, really hard
Yes.
and you will feel terrible and you will feel worse before you start to feel better. And
Mm-hmm.
so that's the time that a lot of people relapse. Is because
Mm.
they don't like that feeling. I think I've said on one of our podcasts before, when I had my back operation 7 years ago, I was on like 3 different types of opiates. And I remember when I started to get off and I felt awful. And I had, for whatever reason, I had this big bag of extra opiates, like a
Mm-hmm.
lot of them.
Mm-hmm.
And I looked at it and I thought, you know what, I could just stop this bad feeling by, just going back and taking an opiate. And I got in the car, went to the pharmacy and dumped them all right then because that draw is so strong. You feel so terrible.
Mm-hmm.
And relief is like one pill away or one drink away.
Yeah.
And so recovery, that first week is really hard. Say you're in a 12-step program. I think with most 12 steps, you've got to have a sponsor.
Yeah.
And so you've got this person who you're talking to and who's, I think the job is to go along with you, especially through those first few weeks as you're
Mm-hmm.
stopping it. And so you really need to power through that first week, second week. And by the end of that 30 days, things are looking actually pretty good.
And it's my understanding that your sponsor has to be part of the program as well,
Right.
which
I
which is
think that's always true. Yeah.
okay, which is incredibly powerful because you can go to your sponsor and say I want to so bad right now, or this is what I'm feeling, this is where I'm at, and your sponsor can really empathize with you and say, yeah, I get it, I've been there, but more importantly, you're not going to feel judged
Right.
because your sponsor is going to understand. And guilt, I think, is an important part of the addiction recovery process. And so, one of the things I wanted to get into is shame versus guilt,
Yeah.
because, guilt and shame are emotions, but one is helpful and one is not.
Yeah. The difference between shame and guilt. And so guilt is I have done something bad.
Yeah.
So in some ways, it's more external.
Mm-hmm.
Shame is I am bad,
Right.
very internal. And I really don't think shame is helpful at all. I think there are some people who have different ideas on that. I think guilt can be a great motivator. Like
Mm-hmm.
if you feel guilty for, say, how you have what you put your family through,
Yeah.
so that's a great motivator. The shame, though, in recovery, certainly with the 12th step, and like if you're an inpatient, if you're in one of those 30-day programs, you're going to do individual work and you're also going to do group work. You're also, I think all of them have family work as well.
Mm-hmm.
So family work is important. The important thing, what Anna Lembke calls truth telling.
Mm-hmm.
And I think this ties into a lot of different areas of the recovery because part of being, say, in a 12 step is you start out and you say, "Hi, I'm Mark and I'm an alcoholic." Letting it out, shining light on whatever the issue is, I
Mhm.
think is the best way to get rid of the shame. And
Yeah.
so she believes that truth telling is really an important part of any recovery process. Part of that goes like in a 12 step program. One of the steps, I think the fourth step, is you have to make amends for
Yeah.
past, things that you've done to people. And in a way, that's starting to tell the truth about things in the past. But I think, and at least for most of the addicts that I've known, lying about their addiction is always really big. I mean, it's a huge
Mhm.
part of it
Mhm.
is the lying. And so a lot of people who are successful. So if you look at people who are successful in recovery,
Mhm.
they tend to be really direct. This is true, especially if a lot of people who work in recovery, so who the counselors happen to be people who have had issues with substances themselves. They tend to be very blunt,
Mhm.
very direct, to the point. It's that idea of truth telling. People who are successful in recovery tend to be rigid.
Okay. Yeah.
And, and I think there's a reason for that because they have to be vigilant all the
Mhm.
time. I mean, you have to be vigilant daily. I think one of the 12 step things that you say is one day at a time. And
Right.
that is true, that it really is one day at a time. And there's something about, I think, the 24-hour period, that what we call the circadian rhythm, that we're really keyed into one day at a time. And
Mhm.
so, you have to be vigilant all the time. And truth telling is one of those ways that helps you be vigilant, and,
So,
or being rigid as well.
right, because addiction is a lifelong process. So,
Right. I would say recovery is a
sure.
lifelong process,
Okay.
is the
Yeah.
way. And I think a lot of people who've struggled with their addiction, when they talk about it, they would say, "I am in recovery."
Mhm.
That
Yeah.
is a lifelong, even if they've been sober for 30 years, they will still say, "I'm in recovery." And that's what I think you're referring to. It's a lifelong thing.
Yes,
Yeah.
because those urges and those desires often never go away,
Right.
which is why it's so much easier to avoid addiction than it is to get out of it. And so, I think that's where that rigidity comes from is structure helps them to stay sober and clean. They have to
Yeah.
set rules, they have to set these boundaries because it keeps them safe, it keeps them in a safe place.
Well, I think that some people who are successful at recovery, they actually become addicted to something healthier. So, for instance, I did see someone, and I wasn't treating him for addiction, but he's been in recovery, but he became so focused on the food he ate.
Okay.
And so the other thing that, again, Anna Lembke would say is that some people become addicted to, say, 12 step.
Mhm.
But, and she acknowledges that's true because they have addictive personalities. At least it's something that's healthier.
Right.
And,
And
and so it's better that they're addicted to that.
and I think that's a very valid coping mechanism for
Mhm.
addiction is replace it.
Yeah.
So,
Oh, I agree. I agree with that.
I mean, because addiction, it's consuming. I mean, it consumes so much of your time. Just taking it away, you have to fill that void. You have to fill that escaping hole in your life. And so
Yeah.
I think if you can find a replacement, something to occupy you, something to keep you busy and that's productive and that's good, then, I think that's very healthy.
Yeah. And so, again, I don't deal with addiction, but I deal with people who are trying to like decrease their drinking or stop drinking or maybe
Yeah.
stop the porn use. So I would say to them, if you remove this, you have to fill that space with something else.
Yeah.
So exercise, meditation. I mean, there are any number of things. Relationships,
Mhm.
that connections give us that release of dopamine as well. And so you want to let that dopamine reward system recover, that 30 days time, but then you have to then be more balanced. I think balance is a word that keeps coming up
Yeah.
in life. And so it's not that you don't want to have pleasure at times,
Sure.
but you have to have balance
Yeah.
in, I think, all things.
Right.
And if you look at our culture, we started out talking about social media,
Mhm.
and they lack balance. Or people who are workaholics. I find that all the time. right? That there's no balance, and they think they have to work all these hours, but there are other parts of their life that are suffering. And I know in other episodes we've certainly talked about the importance of having balance in
Yeah.
your
Yeah,
yeah.
absolutely. So one caution that I do want to give for anybody who is going through addiction is to be very wary and very careful of withdrawal symptoms,
Yeah, yeah.
because withdrawal symptoms can be deadly.
Right, and
And
that's especially true with drugs and with substances.
yes,
Certainly.
yes,
I think that's certainly true with drugs, but alcohol, I think is the one that you have to be really careful with because you can die
yes.
um, if it's not monitored. And so, for many people, like VOA, which is Volunteers of America, is a place, at least in Utah, where people can go if they want to start withdrawal, but have it medically supervised.
So I just want people to be aware of that, that if it's a substance, that's something you maybe don't do on your own. If you think you can handle it without professional intervention, that's fine. But I mean, find somebody you trust that
Yeah.
can at least be with you to make sure that you are safe while
Well,
you're going through the withdrawals.
yeah, and I think with a substance, you really have to. I would consult a physician or even, a substance abuse counselor who has experience with it. They'll be able to, do the assessment and then make a recommendation of, yeah, I think if you're going to stop the substance, you need to go into a medically supervised program for that. So I
Yeah.
think you need some help to get some guidance if it's a substance, if it's alcohol or drugs that you want to get off of.
Right. If it's pornography, then I mean you're obviously not going to have the physical, you're going to have
Right.
mental and emotional withdrawal symptoms,
Right.
but you're not going to have those physical withdrawal symptoms that can be deadly. So, one of the hardest parts about addiction for the loved ones who have someone who's suffering from an addiction is it has to start with the addicted person. It has to
Yeah.
start with them. You cannot force them into an addiction recovery. So, I think step one in the 12-step program is admitting you've got a problem.
Right.
And that's often the hardest part, is my understanding,
It
because
it is. Yeah.
nobody wants to admit it. Nobody wants to admit that it's a problem, and nobody wants to give up their habit. They don't want to give up the addiction. It feels good. Getting that dopamine hit feels good. And nobody wants to give that up, and they don't want to admit it. But you cannot force somebody. We've talked about this before. Interventions are really ineffective. They don't really work.
No, no, but I think that I've certainly worked with alcoholics who, and again, I'm not doing the addiction work. They usually come in because their relationships are really troubled. But, you can talk about their alcohol use and they will not use that word that they're an alcoholic. And
Mm,
it's very hard. And so that is the first step. And it's a very hard step for many people to take. And so for loved ones, if you're married to one or in a relationship with someone who has an addiction, it can be incredibly frustrating
yeah.
because you want them to get help, but they have to want to get the help themselves. And I think often it's sometimes the thing that takes them into recovery is the risk of losing the relationship.
Hmm.
I think it's one of those things, like if you're in a marriage and you're married to someone who's an alcoholic, I think it's one of those situations where if the person isn't willing to get help, then I think you really need to consider leaving the marriage because it's
Yes.
really unhealthy.
Yes.
And but if the person's willing to seek help, then I think that having a loving partner is really important and can be helpful. But you're right, interventions don't work because usually it's you take the person by surprise and they feel forced into it, and it's just not going to work long term.
They have to want it.
Yeah.
And so, you can't force a loved one into an addiction recovery program, but a judge can. So,
Well, yeah, but I think that's only in the case if there's some problem with the law.
right. Which
And
I
I
think
don't know about DUIs. I suppose if you had so many DUIs, then a judge could mandate that.
you have to have problems with the law. And also, I would imagine that the chance of relapse is very high in those instances,
I think it
because
is.
I mean, the person has to want to change, right? I mean, you cannot change other people. I understand it, that the choice, but it has to be incredibly painful to contemplate, setting that boundary of, I'm going to end this relationship if you don't change your behavior. That's a hard boundary and a painful boundary, but don't set that boundary unless you're willing to follow through.
That's right. And that's why it's really hard, because I've often said this, they still love each other.
Yeah.
It's not about love. It's about
Yeah.
behavior,
Yep.
and it's about the addictive behavior.
What I think is the hardest is probably parents. And I sympathize with that, because it must be really hard to cut your child off. But there
Mhm.
comes a point where you're enabling, and you
Right.
can't keep enabling your child as a parent. And, as painful as it is, you can say, if this behavior continues, you are no longer welcome in my house.
Yeah.
That has to be gut wrenching and heart wrenching to do as a parent. And I think there's going to be some discomfort there, and maybe even some guilt, but you're not doing a bad thing as a parent to tell a child that has an addiction or that has really problematic behavior. You are not doing something wrong to set that boundary, right? And
Right.
so I want to be clear about that.
It's just really, really hard. Really
It
hard.
has to be so incredibly hard and painful to do that to your child.
Yeah. But I also think that you have to figure out what's the reason you got into the addiction, which there are
Yes.
many reasons
Mhm.
that people do that. There's not one reason. But I think that's where either a substance abuse counselor or, therapy, group therapy, I think often even in a 12-step, you can get to that.
Mhm.
And so I think you have to be self-aware enough to understand, for instance, are you trying to avoid life? What is it about your life that you're trying to numb out from or avoid? For a lot of people, and I've heard this, it's boredom. They get bored with life.
Okay.
And we aren't used to being bored because there's so much stimulus going on. And so
Mhm.
when people get bored, like kind of a stereotype is, I'll say in rural areas, like up in Wyoming, I think there's a huge, it's a big rural area. And I'm not
Mhm.
picking on Wyoming. It's just the rural area that's close to us,
Yeah.
that there's a huge problem with substance use because of the boredom. There's not a lot to do. And so we have to learn how to be comfortable with boredom.
Or rather, learn to be productive with your time when you are bored.
Be creative, right?
Yeah. Yeah.
With your time. But I think I wanted to add this as a takeaway. Figure out if there is some underlying reason
Yeah.
that you're using the substance. So it's not enough to just get off the substance and reset your dopamine system. You have to figure out what's the trigger.
Yeah. Yeah. You need to know, because if you don't know your trigger, when you're faced with that situation again, and when you are triggered, you're going to go back to it.
Right. And so I think that most people are probably going to need some help figuring out what the triggers are.
Yeah, exactly. All right. So next week, we're going to get into differences in depression. So we're going to talk about how men and women respond differently to depression, and how their treatment can be different, and how it can be the same. So that'll be a good episode, and we will see you all next week.
Have a good week, everyone.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.